HealthCare Community Connection is sponsored by UK HealthCare.
Welcome back. We're joined right now by Dr. Chase Kluemper and Lisa Smurr Walters from the UK HealthCare Hand Center.
Yeah, so glad to have you guys in studio. Dr. Kluemper, how is an upper extremity surgeon involved in spinal cord injury care? Tell us that.
Yeah, thanks for having us. So people who have a cervical spine injury have paralysis to some degree of the upper extremities of their arms, and most of them lose function of their hands, and so it's our job and our opportunity to help identify people who qualify for this surgery. And so essentially what we do is try to take muscles that they have, tendons that they have, and transfer them or reassign them to give them function that they didn't previously have after their spinal cord injury.
And Lisa, what role do you play in all of this?
Well, I get to meet with the patients right before surgery and learn what they want to be able to do. And then after the surgery, I see them roughly within a week and do the rehab portion, which is actually pretty straightforward.
And that's the hard part. That's the hard part.
Well, okay.
She does the hard part.
You do more hard part.
You both are very humble.
I'm amazed by both of you.
Thank you.
Doctor, what can this allow people to do once they go through this?
So it can be pretty life-changing for them, you know, giving them the ability to grasp objects, to pinch, using their thumb to pinch, their fingers to grasp, and a lot of them, you know, tell us that it's really changed a big part of their life. You know, they have the ability to do self-hygiene and feed themselves, and so really it can be the difference in dependence and independence for them.
And Dr. Kluemper mentioned the hard part, the rehab. What does that look like, Lisa?
Well, patients come to see me roughly about once a week and work on their scars and their range of motion, and then we start the functional stuff, which is really fun, just to understand what they want to be able to do and then provide that opportunity in the clinic as best we can. So one patient actually got to eat for the first time by herself without getting assistance, which was really awesome to see.
How rare is this kind of care, doctor?
Well, it's a niche within our field, and so we have the privilege and the opportunity at UK to kind of work with multiple specialties across hand surgery. So it's a multidisciplinary clinic, and we get to take advantage of expertises like Lisa's and ours, and care for people. It's a regional thing, so it's certainly available at other parts of the country, but within the state we're one of only a couple.
And Lisa, you mentioned that one patient that you had that was able to feed herself or themselves for the first time, and I'm sure that was super emotional for them.
Yes.
After the surgery and rehab, what is the outcomes most likely?
They've actually regained a whole lot of independence that they didn't have before. And after you have a spinal cord injury, especially at the cervical level, it changes a lot of things. And so to be able just to do the small things that you took for granted is a really big accomplishment.
Wow. Well, listen, thank you both for coming in to talk about this. It's fascinating what medicine can do. And if you need more information about UK HealthCare, you see it right there on your screen.